Good morning, everyone. Bonjour tout le monde. Before we begin, we'd like to acknowledge that we're gathering on the traditional territory of the Haudenosaunee people, Mohawks of Akwesasne, who have been the original stewards of this land. As many of us are descendants of colonizers or newcomers, we are grateful for the opportunity to gather here and extend our gratitude to all the generations who have cared for this land for thousands of years. May this acknowledgement be a starting point in our commitment to dismantling ongoing oppression and inequalities while recognizing the invaluable contribution, past, present, and future, of our Indigenous people. We continue to use this land acknowledgement as a call to action for ourselves and those around us to engage in the Truth and Reconciliation Commission's 94 calls to action. So good morning, everyone. Bonjour tout le monde. Today we are joined by the team at santé communautaire de l'Estrie. The presentation will be mainly in English, so although it is a French service, recognizing that a lot of you may prefer an English presentation, they will be, I think, maybe going bilingual or maybe fully in English. So no worry about that. Of course, questions can be asked in both languages. And so I won't take any more of the presentation's time. I think we'll get right into it. So this morning we are joined by Eric Marcotte, who is the l'agent de communication. And we have Tanya Svist. Hold on. I practiced earlier and I'm not confident in myself. Tanya Svestrup,
Great.
who is a promoteur de santé, so a health promoter with Les Santé Santé, and they are joined by Chanel Roy for maybe moral support, but maybe chiming into the presentation, but in the little box with Tanya there, and so they'll be obviously presenting on Les Santé Santé's services, but also on Les Cliniques de Soins Virtuels, the virtual care clinics for the Eastern region. So I will leave it to them. And if you have any questions, you can pop them in the chat or you can wait till the end and speak up, and we will do some Q&A at the end. Go ahead, guys. Merci beaucoup.
Parfait, merci. Donc, comme mentionné, mon nom c'est Eric et je suis agent de communication. I'm the communication officer for the CSCE. And Chanel is also our new system navigator for our clients in SDG. So she joined us maybe a month ago, and Tanya has been with us for many years. So we are Le Centre de Santé Communautaire de l'Estrie. Our presentation, like the slides are bilingual, but like mentioned, we'll do it in English, so it's just maybe easier for all of you. So who we are, the CES is a place where people can receive healthcare and support within their community. We're providing holistic, integrated, interprofessional, and collaborative services to address the underlying determinants of health and thus improve the health of francophones and the most vulnerable population in Eastern Ontario. We have six centers, six locations. We have one in Alexandria, Bourget, Cornwall, Chrysler, Embrun, and Limoges. And our Cornwall Center mainly offer French services to people in Cornwall, and then the other five locations centers offer bilingual services. Our services, we offer primary health, mental health services, community health services, diabetes education program. We have nutrition, chronic disease, and we'll briefly talk about the wellness, the youth wellness hub that's available in Cornwall. And our wonderful team our interdisciplinary team works together to improve access and the delivery of care for our clients. So we have admin team and secretaries, we have dietitian, mental health therapists, we have our doctors, nurse practitioner, nurses, and then we have our community health workers, health promoters, and newly our health system navigators.
And now I think it's on to me, right?
Yeah.
Okay, so I'm going to talk or present the teams that Eric just mentioned in a little bit more detail. So our primary health team provides a variety of healthcare services centered on individual needs. So we have nurse practitioners, medical doctor, we have a healthy baby clinic, palliative care, wound care, immunization and vaccine clinics, and as well as a host of other services. That's all under primary health. Our mental health team, we have a team of therapists that offer individual counseling sessions. We also have group sessions, psychoeducational workshops, and couples therapy, where I'm going to pause for a second and do a little quick plug of, we'll send this out. I think actually Carrie Lynn would have shared this with many of you or all of you. We have a session coming up, or that's going to be starting on March 11th, called Hold Me Tight. Conversations for Connection. So it's a relationship education group for couples, and there are still spaces left. So that would be great if you can all push that, or, you know, if you have clients that could benefit from it, please promote the program. That would be great. The services in mental health are available for people 17 and over. And then we have our community health team, who promotes the adoption of healthy lifestyle habits among clients and communities in general. We encourage community engagement by participating in a variety of initiatives and a range of workshops and group activities. And here again, I'll make another quick plug, and we'll probably be sending this to you, Carrie Lynn, shortly, if I haven't already, for another workshop that's coming up. It's called, it'll be offered in French. It's Vivre une vie saine avec la douleur chronique, or Living a Healthy Life with Chronic Pain. That's coming up mid-March, and it's a virtual program that is offered under the umbrella of Living Healthy Champlain. It's a 6-week program to give people tools to self-manage and just get support for managing their chronic pain. We also provide navigation support to individuals in vulnerable situations, and Chanel has been on board for a little over a month. 2 months. 2 months. Yeah. Well, time goes fast. And we also have another person out in the Prescott Russell area who are really taking on this navigation support for individuals in vulnerable situations, and giving them or sending them towards appropriate resources tailored to their needs. We have a diabetes education program in all of our sites, I believe. Not on all of our sites. Okay. Hard to keep track when there's 6 and I'm mostly in one. But we, our diabetes team provides group education and individual appointments to empower clients with pre-diabetes and diabetes with skills needed to actively manage their condition on a daily basis. And I know for sure there's a diabetes program in Cornwall, Alexandria, and we can, if you have questions about the other sites, or Eric, you can chime in. And
yeah, we offer it in Chrysler, Embrun, and Bourchette, and virtually also. So
okay, so just not as much.
Yeah.
Okay. And then we have our nutrition team providing individual consultations. They also have group sessions to promote adoption of healthy eating habits while respecting clients' individual choices, lifestyle needs. These services are accessible to all, babies, children, adolescents, adults, and seniors, and you can self-refer to those programs. And then we have a variety of chronic disease branches or areas, if you will. So our professionals offer individual consultations and educational group sessions. We have a memory clinic in Embrun, cardiac rehab program in Bourget, a low back pain project in Alexandria and Cornwall, lung health program in Bourget, Chrysler, Embrun, and Limoges, and aging at home for the Prescott and Russell counties. So a little bit more detail on our low back pain project. So lumbago is the medical term to describe low back pain. I had to look up put lumbago into online to see how to pronounce it. I wasn't sure if it was lumbago or lumbago. So it's lumbago. medical term to describe low back pain in the region of the lumbar vertebrae. Chiropractors provide treatment, assessment, and education to clients who can't otherwise benefit from these services due to income or insurance or lack of insurance. And the service is offered at our Alexandria and Cornwall sites. And then finally, for me, we have our youth wellness hubs. The hubs serve local youth as a fully integrated one-stop shop where youth between the ages of 12 and 25 and their families can address all of their health and wellness needs. And some of the services that are offered include mental health, substance use, primary care, and community services.
And you can go on the Youth Wellness Hub website to learn more about their services and their programs. They have a calendar every month that of activities they offer in Cornwall to the people aged 12 to 25. So we have our activities. So our activities that we offer are free of charge, except sometimes there's material cost in some cases. It's open to all based on the eligibility criteria, and registration are required. So if you go on our website, you can just find our calendar, our guide under the calendar section, and you can just download the PDF. That's right here. And then it's divided, so we'll have one from May to end of the summer and then one for the fall. So all of our programs are divided by our teams, and we see we have different course classes, workshops, groups that are, we have the description, and then we have like the times, the date, if it's virtual or in person. So we have in nutrition, we have like feeding our baby, feeding our child. We have craving change, healthy eating, and then it goes on for all of our team that are offering different programs. And it's all divided, and it says if it's like Tanya offers a program in Cornwall, but it's only offered in French, but then like some of our programs are only in English or offered bilingual. So you can find it quite easily on our website. And then that's the course the group Tanya was talking about, Hold Me Tight. It's only offered in English virtually for people in relationship. That's starting in a few weeks. So we all have that. We have all those course programs and activities, and they vary throughout the year. Sometimes they're offered once or twice a year. So it's a good thing just to open up our guide and look up what we're offering. And then right now, people, if they want to register or they want to have more information, they can always send us an email or call one of our centers to know more or learn more about our programs and the activities we're offering. So right now, or how our referral works for primary health, our waiting list is closed. So we do not accept anyone on our list right now or offer any primary health services to people that are not in our clients or that are not our clients. For mental health, it can be referral or referred by a professional. Every community health services. We're not yet doing, Chanel is not doing any system navigation, helping people that are not in our clients right now. It's only offered internally. And then same thing for diabetes, nutrition, people can self-refer. And the Youth Wellness Hub, just contact the hub to know more about their services and how they do their referral. Uh, have they done a spotlight in the past? Do you know? Not yet. So Michelle is there. You can just send them an email or phone at the Cornwall hub, and they will be able to give you more details. And for our chronic disease, we only offer a self-referral for the low back the low back pain project in Cornwall and Alexandria, and the aging at home. That's only offered for people who lives in the Prescott and Russell counties. And then people can just on our website we have our section to contact us. People can just send a request through that by email or by phone, so they can just go on our website, find the center they want to call, and then they can call and we'll be able to help them. So we're helping the ERVCC, so it's the East Region Virtual Care Clinic. So it's program that the Durham Community Health Center manage, but in the Eastern region, we are helping just to do the promotion. So it's any if you can receive care today from the comfort of your home by booking an appointment online or on the online or over the phone, and they offer various services depending of your situation. I should have open. So people can go on their website. They offer services to people, anyone in the East Ontario Health East region. So it's a big region that they cover, and they give services to people that do not that have a healthcare number or not, and they also offer services to people that have a family physician or nurse practitioner or without. And the nice thing about the virtual clinic is that physician won't be charged a fee if the patient goes and uses the service for at the virtual care clinic. And they're quite fast, so people you have to call, uh, and then yeah, you can call in the morning, and then they offer services between 1 and 9 p.m. 7 days a week. And then while people are booking their appointment, they prioritize the who's being called first by the the reason why people are making the appointment, and it's managed by a nurse practitioner. They offer services in French and in English, and it's important to note that they're when people are using the service, the nurse practitioner won't become their primary healthcare provider. It's kind of like a walking clinic, and there's some care that are appropriate for the virtual care clinic, and some are not. So people can just go on the website and see if they can help them with their situation. So people, I know the Great River Health Team, Ontario Health Team, have made a lot of promo in the SDG Cornwall region. But if you want some rack cards or more some images for your social media, or if you have a TV in your waiting room, we have all of those tools that I can share with you just to promote the service. And then just to join us, you can always join us through our website, our email address. People can phone any of our location, Facebook, and now we just started our newsletter. So if people want to subscribe, you can just scan the QR code, and then we'll be sending one every month. So that's it for our brief presentation of our services. So if you have any question, me and Tanya are here to help you. They can be in French or in English.
Anyone have any questions? I do just want to mention, you heard Tanya a couple of times say that Carrie Lynn has sent this off to her email list, or we're going to send something to Carrie Lynn to send to the email list. If you're not on our email list. I'm sure most of you are, but I do know if you are not, you have at least all received an email from me since you have registered for this. In our signature, there is a link to subscribe to our email list. And through that list, we share a lot of the community. Oh, Mel's just put it in the chat. Great. Thanks, Mel. And you'll learn about all of the programs and services that Santé Santé shares with us, but across the region, from healthcare to social service and everything else in between. So a little plug for that. If you're not subscribed, we're happy to add you and share as well. So I will open it again for questions. Any questions for Eric or Tanya? Seeing none, I want to thank you both for presenting this morning, and thanks everybody for joining us on a Friday morning. I want to remind everybody of our next community spotlight, which is happening on March 28th. We will be joined by Suzanne from Vista Center Brain Injury Services, and we are currently booked into 2026 right now. So if your organization is looking to be added to the community spotlight schedule, we've got February 2026, so a year from now has your name on it. Please reach out. Happy to add you to our schedule. Merci. Thanks, everyone.
Thank you.